Welcome to True Health Tuesday, and the truth will set you free. Okay, today is voting day, so hopefully you went out there, made your vote, and I hope your candidate wins, okay, or your proposal wins. Today, we're going to talk about blood pressure solutions. So normally when we do a talk, we talk about the dynamics of it, how it is, the history of it. Why? Because I like teaching like that, okay? And I think it's cool the more you know. Not this one. I'm going to show you how to lower blood pressure in one day, okay? But you've got a different view of what blood pressure is. Now, is high blood pressure the silent killer? It can kill you, okay? Is it really, or is it an intelligent adaptation from a response to stress? Because if it's an adaptive response, if your body is changing its pressure based on the stress level that you're under, then if you medicate that without dealing with the stress, then the medications can kill you. So, let's find out what is the body. Well, first, your body is self-regulating. Whoa! You mean it regulates itself? Like, what animal on the planet can't regulate their own physiology? Can beavers regulate their own bowel movement, or bears their own, digestive factors? Does a deer get cut and says, hey, don't bug with me, I got to heal that? No, this is all stupid stuff, and it's stuff you've been lied to. Your body is self-healing and self-regulating. You utilize the nervous system to adapt to the different stressors. You have an automatic nervous system. One part is fight or flight or sympathetic. The other part is rest, digest, and repair. That's the parasympathetic. They're located in structural aspects of the body. Parasympathetic is located in the sacrum and the upper neck area. The sympathetic is located in the thoracic area. That's it. When you're under physical, chemical, or emotional stress, fight or flight kicks in, and that elevates blood pressure. It elevates blood pressure. It elevates blood pressure, okay? When you're at the rest, digest, and repair, the blood pressure starts to go down and blood gets funneled to the digestive aspect and the immune system aspect. That's called a rest, digest, and repair. So when you're resting, the parasympathetic gets activated. When you're under physical, chemical, or emotional stress, the sympathetic gets activated, okay? Any problem with that? So since the body is self-healing and self-regulating, got to think of it. When blood pressure or high blood pressure is diagnosed, does the doctor go through and do a thorough assessment of your physical, chemical, or emotional stressors? Do they say, gee, how many bowel movements a day are you getting? Are you getting up at night to pee? Do you have any, excessive physical, chemical, or emotional stress load? Let's find out what your body is like. Would that make more sense? Because when you're looking at this, all the stressors in the body, all the things that are going to do an imbalance of the autonomic nervous system can be boiled down into three things: physical, chemical, and emotional. And these have solutions. So if you have physical stress, like you've had a trauma in high school, you ran over by a car when you were 30, fell off a building when you were 20. Okay, I'm the only one. Okay. No, you had traumas too. We all have, okay? So those kind of past traumas can have a physical stressor on you. I can't tell you how many times I'm talking to a patient and they'll go, yeah, doc, no, I've never had a problem with my neck. I've always been fine. And I go, no, man, And I'm talking to like a 67-year-old guy. Okay, did you hurt yourself skateboarding when you were a teenager? Snowboarding? Because all of those physical stressors are going to put you in that sympathetic dominant state. And if you don't understand that the body is self-healing and self-regulating and presents itself with the best way it can, then you're going to miss the big picture. So you got to assess the structure. You got to get a full x-ray, maybe heart rate variability. I'm going to show you a couple of ways to do that. But also what we'll look at is, I'll say, take off your shoes. And if you see beginning bunion formation where that big toe starts to lean towards the other one, that means the pelvis is compromised. There are the nerves that supply the foot, and those come out of the pelvis. So that could be a dysfunction of the parasympathetic. So pelvic dysfunction, carpal tunnel syndrome, okay, that's numbness or tingling in the hand. That's a double crush injury beginning in the neck. So all of these things are clues. They're little clues left that your body could have a physical stressor. Chemical stressor. That's easy today. We're loaded with it. I mean, you're talking 72 doses of 17 different vaccines for a kid that's 18 years old. Okay, that's a little much. What about the chemical stressors in the food, or the preservatives, or the toxins in the food? You get concentrating feeding operations. These are literally antibiotics in the food that we're eating that destroy holes in the gut. It's called an increased gut permeability. That's for the medical professionals. Others of us know it has leaky gut, okay? And so all of these things are going to damage the body. It can thicken the blood, but what it's going to do, it's going to make the blood not efficient. See, the blood has a function. If you're chemically poisoned, the blood has to regulate pH, carries oxygen, it eliminates carbon dioxide, vital to the immune system, regulates pH. It has functions. And if your blood isn't healthy, guess what? The pressure's got to adapt to that decreased function of the blood. And then you got emotional stressors. Gee, welcome to the world, okay? And if you're dealing with emotional stuff not effectively, okay, it can wear you down. It really can. I mean, we've had patients coming in here diagnosed with multiple sclerosis and strokes and Parkinson's and autism, all of these different diseases that are supposed to be lifelong. And what does that do to your mind? What do you think? Do you think it's going to make you really happy or scare the hell out of you? And so what does that do? That stimulates the sympathetic nervous system. So 100% of people that with a chronic illness or injury, we have to go through and we reprogram their brain to deal with the emotional stressors. But by God, if you don't know that the emotional stressors can alter physiology, can literally alter your function, you've got to learn how the body works. This is why with a completely dysfunctional medical system, you're not going to get this. So what regulates your physiology? Your nervous system. What changes that? Physical, chemical, or emotional stress. Because you get people that say, oh man, high blood pressure, it blows up kidneys, it destroys your gut, it's going to cause stroke, it's the silent killer. And then you think, well, God, that's pretty friggin' stupid. Okay, if we're going to go out there and we're going to chase the antelope down, and you're a hunter-gatherer, and you're running like crazy, does your buddy say, don't run so fast, okay? I know you want to catch the antelope, but you know high blood pressure is really bad for your kidneys. No, let's look at this with intelligence, okay? If you have toxic, sick blood, you're physically stressed, you're emotionally stressed, you're in sympathetic dominant mode. Sympathetic dominant means your body is going to elevate cholesterol. It's going to elevate blood sugar. So the blood gets thick, so pressure has to increase. So now if you're under chronic stress, day in, day out, year in, year out, physical, chemical, and emotional stress, what do you think the health of your organs are going to be? Good or bad? They're being worn out. They're not being regenerated. So it's not high blood pressure kills. That's stupid. Okay, but if you have a toxic deficient lifestyle, the blood isn't healthy. So your blood pressure has to elevate in order to get the same function because the blood's toxic. It's loaded with cholesterol or blood sugar because of those stress hormones. Or dehydrated, the blood's got to increase. So it's not that high blood pressure causes these diseases. That doesn't make any sense. A sick, deficient, nutrient deficient, toxic body, the blood pressure is going to have to raise in order to adapt. Does that make sense? So it's not high blood pressure kills kidneys. If you have damage to the kidneys, think of this, they're filters. Every 20 minutes, blood's got to filter through it. And if you damage those kidneys, now let's say you had, like today, I had a patient, 17 years of Motrin, a non-steroidal anti-inflammatory. Yes, it does destroy joint cartilage, and yes, it is one of the top things recommended by your doctor for joint pain. Okay, does it damage the kidneys? Absolutely. So if you have less surface area in the kidney because of toxic damage, because you're taking the non-steroidal anti-inflammatory under your doctor's recommendation, guess what happens? You got to get the same volume of blood through. So you have to increase that pressure to get it through there. So kidney damage causes high blood pressure to adapt to it. Not high blood pressure causes kidney damage. I know right now I can see through the TV that there's about 20 MDs that are smoke coming out of their ears going, dude, that can't be, because I was taught that high blood pressure damages the kidneys. Okay, let's wake up, okay? Do you see kidney warnings on stress machines at the gym? You know? No, you don't, okay? This is crazy world. Let's look at this, okay? When we look, regardless of the etiology, that chronic illness or disease comes from an autonomic, they say dysfunction, I say an autonomic adaptation. By God, that makes sense, because think of this. The nervous system regulates everything, controls and coordinates every function of the body, including hormone production. So if you're in a sympathetic dominant state, what happens to blood supply to the gut? It shuts down. What happens to the immune system? Weakens. What happens to blood supply to the digestive tract? It shuts down. So does this mean inflammatory bowel disease, irritable bowel, digestive disorders, reflux, chronic immune system problems? Could these all be from a stress adaptation of a chronic sympathetic dominant or chronic alteration in it? They say so because they say regardless of the cause. It doesn't matter the cause. Chronic illness has to do with an autonomic dysfunction. I say an autonomic adaptation. So I'm going to show you how to lower blood pressure today, one day. Is that good? Is that good for everybody? Okay? Ready for this? Breathing. Yeah. Pretty cool, huh? Okay, so no longer we don't got to worry about blood pressure. We don't have to worry about lung function or kidney function or stroke or anything else, okay? Because if you're taking blood pressure, 5 times a day, and I'll get people in there who've been freaked out by BDS, or it's actually bad medical doctors, okay? It's BDS is bad doctor syndrome, okay? But there are so it should be bad doctor syndrome because there's a lot of chiropractors that don't understand this. But you get these people, oh doc, yeah, I check my blood pressure 7 times a day, I do it all the time. And I said, okay, good. Are you deep breathing? Well, I'm sitting down, I'm feeling really relaxed. I said, yeah, dude, you seem really relaxed right now. Okay, so you look at this and deep breathing. Now you have the nerve that supplies the diaphragm, comes out of the base of the neck. C3, C4, C5 keeps you alive. This is how you remember it. Did they teach the same mnemonics in medical school, Doc? No? Okay. Yeah, chiropractors like it because we got more rhythm. Okay, C3, C4, C5 keeps you alive. So this way the phrenic nerve comes out of here. That's the diaphragm, the muscle that when you breathe in, this diaphragm comes down. Okay, that's it. You breathe out, it comes up. Now you might be thinking, damn, that comes out of the neck. What if you had a whiplash trauma or some type of chronic degenerative disease? Could that alter the phrenic nerve? Absolutely. This is why somebody comes in with blood pressure. What are we going to do? We're going to check the parasympathetic nervous system, which is up here. We're going to check the base of the neck to see if there's any long-term problem there. And then we're going to teach them how to breathe. Okay? You forgot. Okay? I'm going to show you how to breathe. For one, most people are going to breathe like this. See, that's a deep breath. No, it's not. The diaphragm comes down. Okay? Stomach contents have to come out when you breathe in. If you're deep breathing, because this type of breathing, where you're moving your chest, is using the top third of your lung, which has the least surface area. What you want to do is get more oxygen to the greater surface area of the body. It's called diaphragmatic breathing. And I'll tell people, I'm going to teach you how to breathe diaphragmatically. Do you know how I do this on a patient? Because I'll say, okay, Bob, take a deep breath. And I'll say, okay, the diaphragm's got to come out when you breathe in, and the chest shouldn't move. Try it again. Okay, and I'll say, well, you're breathing like an American. So I said, Bob, put your hand right here. Now I'm going to punch you in the stomach. And this is a way to teach yourself to diaphragmatically breathe. If somebody punches you in the stomach, does the air go in or go out? Here, I'll demonstrate. Anybody want? No, I'm totally cool with demonstrating. Okay, and this is what you got to, because you got to get that dramatic thing to get people to breathe. So you put their hand in there and you go like this. You go, blow out. Okay, now breathe in and push out. Blow out, push in. This is how you learn to diaphragmatically breathe. Or watch a child. Kids already breathe that way. Now, if you want to kick it up a notch, you breathe in through your nose, which bronchodilates, so you're opening up the lung vessels. Just try it right now. Breathe in through your nose and fill your tummy with air. Now blow out. Try it. That's 2 breaths. How many people feel a little dizzy? That is a good high, okay? I mean, people next door at Shooters, they got to get drunk and stuff to get that. This one's clean, and it lowers your blood pressure. But all you got to do is do it for 10 minutes. 15 would be fine. Or spend $350 to $400 for a machine called Respirate. Okay? As simple as it sounds, this is FDA approved, works better than 2 blood pressure medications. You do it 15 minutes and it lowers your blood pressure all day long. What do you do? I know it's a miracle, drug-free, okay? It has a breathing sensor on it. You listen to a friggin' tune. Am I the only one that remembers Walkmans? I know you're too young. Walkman? Okay, good. Yeah. Cassette? Dude, yeah, okay, good. Those were reel-to-reels. Okay, so when you look at this, you'd breathe in, but you'd breathe into a tune. And so it forced you to literally slow down your breathing. So you breathe in, you go, and that's what the machine does. I don't want to steal its thunder. I mean, you can get it. It's kind of fun for parties. But literally, when you're deep breathing, it literally works. This guy's saying it lowers for high blood pressure, 17 points, 20 points. I mean, this is huge. But all it is deep breathing. Now, we're not talking about looking at the autonomic nervous system. We're not talking about dealing with the physical, chemical, or emotional stress. We're not even talking about drinking more water, which will actually thin the blood, or eating a plant-based diet, or taking healthy fats. A Mediterranean diet would be great. Okay, all of these things, plant-based, okay, organic, no animal products, or little animal products if they're healthy animals. And this works. Just deep breathing. That's it. So all you got to do is deep breathe. But now, what's the best time of the day to measure your blood pressure? What should a normal blood pressure be? See, I'm laying this out so I give you the solution first. How do you fix high blood pressure? Find the stressor and deep breathe. Done. Okay? Now, let's look at this guy, 24-hour monitoring, and his blood pressure. When was the best time to measure? Gee, I don't know. It goes up and down all over the place. It seems like measuring it when he's asleep or, not having sex. So you look at this and it's all over the place. So what I tell patients is you want to be in the same metabolic state to get blood pressure. And then you got to walk people through, because they've been lied to. They think that the doctors really know what the hell they're doing, and that it's coming from based in science, and that your blood pressure has to be some number, and take this because you're going to die if you don't take it. Okay, so they're coming from a distorted view. But this right here, walk them through. Say, look, do you want to take blood pressure when you're walking upstairs, or taking a couple of shots of coffee, or really stressed out? And they'll say, no. Why? Because blood pressure goes up and down depending on the needs. So all you got to do is sit down, resting with your arm level, 10 minutes, deep breathing, and then check it. Okay? Now, what are you looking for? What number? And I'll ask people this, because I like putting people on the spot. I could blame my upbringing. I think my sons have caught it too. Are you sarcastic, Michael?
Not as much as you.
Not as much as me. Thank you very much. Okay. I didn't teach him well enough, okay, but so when you look at this, what number are you looking for? Because people are saying, Doc, what do we do with their blood pressure? What do we do? Well, what number are you going for? Well, 120/80, that's what my doctor said. Well, not really, because this is done by a joint national committee, usually, okay? They meet about every 10 years. 1997, they said, bam, 120/80. Now, this is regardless of body height, size, weight, ethnicity, background, anything. So we have a worker over there who's about 400 pounds. He comes in here, very heavy set guy, morbidly obese, and he should have the same blood pressure as the 18-year-old gymnast. That makes sense to anyone? No, for every 1 pound of fat, you have an extra mile of blood vessels. Okay, so these people are not healthy. Now, he is under physical stress. Okay, the 18-year-old kid, as a gymnast, is under physical stress. but shouldn't you physical, chemical, and emotional stress assess them correctly? Well, they did in 2004. They changed it. It was no longer 120 over 80. It was now 115 over 75 for everybody, regardless of age or health or status or anything. And they said, and this sounds really cool, good God, your risk of cardiovascular disease increases. In fact, it doubles for every increment of 20 over 10. Doesn't that sound like authority? Like, damn, if I had a white jacket, wouldn't you be just shaking? Saying, I got to get it down. I got to get it down. I'll do anything to get it down. Please give me that diuretic or ACE inhibitor or beta blocker. Okay, so then 2014 comes around and Joint National Committee 8 meets and they say, we have new evidence-based guidelines. Oh, I thought you were evidence-based back in the 90s. Was that a bunch of crap? Were you lying to me? Were you just freaking guessing? Did you do this with no basis in science? And you got the white jacket and you're giving me a poisonous pill, and then you say, now it's different? Well, the American College of Cardiology and the American Heart Association now broke from the guideline of if you're over 60, it's 150 over 90, and if you're under 60, it's 140 over 90. That just wasn't good enough for the American College of Cardiology and the American Heart Association. They think 130 over 80 is right. What data did they use? What data did they use? Because remember, these guys are supposed to be based in science, right? They're not looking at the physical, chemical, emotional stress. They're not looking at the sympathetic dominant. They're not doing any tests at all. They're just checking your blood pressure. And then what are they looking at? Well, current evidence doesn't support an absolute threshold initiating treatment, whether 130 over 80 or 140 over 90. There's no data to support it. I read a couple of articles on this and I'm going, no, dude. These guys gotta have some kind of data to support their change. They can't just say it felt right. Because you went from 32% of Americans being high blood pressure, they changed the number, now it's 46%. They can't do it on just shits and giggles, but they did. Well, what happens if you're taking multiple blood pressure drugs? It must be okay because they're randomly changing these numbers that have no basis in science. So taking the drugs must be good for you, right? No, it turns out that even though you have excellent control with the drugs, your risk of stroke increases every time you take one. You're in as much trouble by the time you're on 3 medications that achieve excellent control. You have excellent control with the drugs as you are when your hypertension is untreating, which is amazing. We want to raise the issue that despite great advances in a pharmaceutical approach, relying solely on this approach is going to come at a dear price of people's lives. What number are they going for? Okay, what's a good blood pressure number? Nobody knows. It's what your body is. Deep breathe 10, 15 minutes before and you're going to find it. What if they're all wrong? What if systolic over 161 had lower death rates? Well, let's look at a study of 48,000 heart failure patients that was published in the Journal of the American Medical Association. And they say, damn, it turns out these people with heart damage lived longer and better if they had higher blood pressure. Does that make sense to anyone? It does if you're common sense, okay? There's there's a few here. Okay, a few here are going, yeah, that makes sense, because you got damage to the heart, so you might want to increase the blood perfusion, the blood pressure to keep that damaged tissue alive. Hell, that does kind of make sense, doesn't it? But no. Are they going to say, look, we're going to change it. It's now 130 over 80, unless your Joint National Committee over 8. And then it's 150 over 90. Then if you have heart disease, your systolic's got to be over 161. Wouldn't you like to see that? Well, what about stroke? What about stroke? It's the silent killer. It can damage kidneys. It can damage stroke. It's going to cause strokes. Okay, let's look at stroke people damage. It turns out that if you've had an ischemic stroke where part of your brain is not getting blood, because remember, I think that the body is going to elevate blood pressure in order to keep that blood flowing, to keep the tissue alive. It doesn't cause stroke, but if you have arterial damage, by God, that body is going to elevate that blood pressure in order to keep that tissue perfused. Does that make sense? Here's a list of strokes that they artificially elevated blood pressure by 20% up to 200 millimeters of mercury in systolic, okay, which is considered very, very high, but it kept people's brains alive. They worked better. And we've got a couple of nurses here that work in stroke wards that they do artificially elevate the blood pressure in people that have had strokes to keep their brain alive. Now, any mechanic in here, anybody that's ever worked with a stuck bolt that had to get something done mechanically, does this make sense? Yes or yes? Absolutely. You got to keep the brain alive, okay? And then you talk about this inaccuracy of measurements. Hell, we don't even know what the number's supposed to be in the first place. But they're saying if you measure this white coat hypertension, has anyone been in a dentist chair? They pull out the needle and they say, this will pinch a little. Okay? Yeah, and it does look like that, okay? Does your blood pressure go up or down? Well, I mean, based on the setting, it can change between -23 and +33 millimeters of mercury. Then let's say we come up with some number that we're going to go along with. Joint National Committee 6, Committee 7, Committee 8, or we try the new stuff, American Cardiology, or I don't know, whatever you want, because evidently none of it's based in science anyway. Okay, just pick a number. Okay, so let's treat it with calcium channel blockers. Oh, that's a bummer. It could increase heart failure, according to the American Journal of Cardiology. What if you treat it with diuretics? Okay, this is the first line. Of course, I know what you're thinking. Don't diuretics damage the kidneys? They do, but it lowers blood pressure, okay? Now, then you get, 4,200 more deaths, 37,000 more hospitalizations. Now, this was back from 2004, so I decided to look at more stuff. This was an article back in '85 that people lowered the blood pressure to 140/90, and they had to stop it because, again, the diuretics were killing people. Now, so I thought, let me find out. Are diuretics really that dangerous? Because when they first came out, they were held as like a miracle. I mean, it reduced cardiovascular disease, but those studies weren't really long-term. So I look at this one, and this is out of the PLOS.org journal, and I think it was published, like 2014. I should have put the date up here. But it says, however, there are no randomized controlled trials evaluating their long-term safety, and several observational reports have indicated adverse events. Absolutely, and they're talking about diuretics. Well, doesn't it seem strange? Now, what about plasma viscosity? Again, I'm just talking to practical people. How many people in here drink enough water? Okay, how many people do you think outside of here? Okay, yeah, snuggles, giggles, okay. So when you look at it, now if you're not drinking water, do you think that the fluid inside of your body might get thicker? Okay, what do you think has to happen to the pump in order to push the thick fluid through? I know, see all the hints I'm giving? Okay, I want you to pass the test. Okay, I really do. Okay, so you look at this and you think, damn, plasma viscosity. Okay, they knew this back in '89. So could drinking water along with the healthy diet of plant-based organic food and deep breathing, could this have a radical effect on your chemical stress? And remember, I'm not saying blood pressure. I'm saying chemical stress. So this is a good way. This is the new way. See, blood pressure is a pretty piss poor way to check your health. It really is. Pulse pressure is a more accurate way. Because, I mean, blood pressure, let's face it, unless you're sitting down deep breathing for 10 minutes, you're not going to be in a healthy metabolic response. If you're stressed because this person taking your blood pressure might be talking to you, and talking, a cold room, full bladder, all of these things will change the blood pressure. So let's look at the pulse pressure, the difference between the high and the low. And this is not like, oh my God, this is set in stone. Let's look at it with common sense. The difference between the high number, the first number, which is the systolic, that's generally considered the output of the heart. The diastolic is the overall resting pressure of the body. So you've got a pump, pressure, pump, pressure. So if you have a sick blood, sick, unhealthy body, that pump has got to be working harder and faster to get the pressure of the overall system elevated. Okay, if your blood is, let's say you're in extreme stress, you want a lot of tissue, blood perfusion in the tissue because you're going to be running away from danger, you're going to be in high stress. So the difference between the output of the heart and the overall pressure of the body will be less. So think of this, okay, we need so much blood into the body. We're under stress. What has to happen? Okay, pressure has to increase. Why? Because we need to use our muscles more. We need to use our brain more. We need to we're using our muscles, so we got to get rid of that carbon dioxide. So under stress, physical, chemical, or emotional stress, that pressure has to be higher. So the difference between the systolic and diastolic will be less if you're under extreme stress. Now, let's say your blood isn't really efficient at doing its job. Okay, you got a crappy lifestyle, you don't sleep good, you got poor toxic food you're taking in. So the blood really isn't efficient at doing its job. Maybe you don't like water. Okay, so the blood gets thick. Okay, it gets thick. So the difference between the pulse or the pulse pressure will be greater than 40. So 40 is like a rough guide. Greater than that means the blood's generally not healthy. So drink some water, get on a plant-based diet, go on the Mediterranean diet, stop eating crap. And if it's closer than that, look at the physical, chemical, and emotional stressors. Does that make sense? I mean, so it's a real rough guide because it's not really that good. And how do you take blood pressure? Well, first off, decide on a number. God knows the medical system hasn't. Okay, so pick one. I would go on the pulse pressure, roughly 40. Okay, and so you sit down, deep breathe 10 minutes. And the reason I got the caribou up there is because when a caribou is running away from a wolf, and I actually saw this, and it was really cool because, I mean, I don't know what type of people, that you might look at who's watching an animal thing where a wolf is going to eat a caribou, but I was kind of voting for the caribou. I wanted the caribou to get away, even though I like dogs and stuff. I thought it'd be cool. And the announcer was saying, if the caribou doesn't stumble and maintains their speed, their endurance can outlast the wolf. I'm going, holy shit, can't you speak with some enthusiasm? My God, this little creature is going to get destroyed. Okay, so I mean, my blood pressure was going crazy, but so was the caribou. Okay, and then when the caribou got back to its herd and it was safe, and the poor little wolf back there was just panting like crazy, it just started to eat again. Okay, so know that nervous system can change very, very rapidly based on your circumstances. But these circumstances are in your control. Deep breathing, and look at the physical, chemical, and emotional stressors. Now, when we look at this, as we age, our arteries get less flexible. And the arteries have an elastic tissue in it. And so think of like a boxer running up against the ropes of a ring and they bounce off. Okay, they're using that springability or that energy in those ropes to propel them. Okay, now that's the same thing your arteries do. So the pulse pressure is going to change as you age. And typically what it was before they got crazy with the medications is it was 100 plus your age. So that would be your normal systolic. Okay, so 150 if you're 50, 160 if you're 60, 170 if you're 70, and this was considered normal. So what are the causes of this? No, there's a lot of causes, but you can say, are these really causes of high blood pressure or are they stressors? Is sleep apnea or laying down, not sleeping correctly, would that cause high blood pressure or put you in a stress state? Obesity, does that a physical stressor? Absolutely. Pregnancy? God, that's an emotional stressor. That sucker's going to come out and you're going to have to take care of it. Oral contraceptives? Oh my gosh, okay. Let's give a synthetic estrogen that increases your risk of cancer, but you can party now and not get pregnant. Anybody think that might be a stressor on the body? Yeah, so this is what we got to look for. If you have any type of blood pressure analogy, it is not a silent killer. This is the undiagnosed physical, chemical, and emotional stress. The undiagnosed, untreated, unaware doctors that are checking your physiologic response. They're seeing you're in a sympathetic dominant state, and they're not going to look at the cause. They're going to go on what they think is normal now. Why not normal back in 97 or 2004? Or now, it's a crapshoot. Ignoring the physiology of the body, the adaptability of the body, these guys got to be fired. Oh, look what the Journal of the American Medical Association says. Many current practices that seem logical but are without evidence. Anybody think that the blood pressure number is based in evidence? Anyone? Anyone? I would like to see it. Without evidence may be reconsidered and incorporated into a less dogmatic and more patient-centered approach to care. Patient-centered, does that mean that we should look at each individual person and check how their body is functioning? Each person, ask them, how many bowel movements a day do you get? Okay, what's your attitude like? Do you wake up with plenty of energy? What the heck is going on? Okay, here's a patient that I absolutely adore. Okay, I always talk about my sweetheart. When she smiles, my heart lights up. This gal, same if not more powerful. She smiles, the whole friggin' clinic lights up. Okay, but this scared the heck out of me. The picture on the left is her when she came in. Now in 2008, she had chemotherapy that damaged the heart. She came in and the doctors, really wonderful doctors, they gave her 2 weeks to 2 months to live. Scared the hell out of me because I really fell in love with this gal. She's amazing. But that on the right, or the left there, it shows a low functioning parasympathetic, and the nerves right here, right here are rotated massively over to the side. That's the sympathetic nerve supply to the heart. When you see a right rotation like that, and this is the patient facing it, and you see a low functioning parasympathetic, that is the most dangerous circumstance you can find. Heart attacks do not come from clogged arteries about 80% of the time. They come from an alteration in the nervous system. And this gal already had neurotoxins from the chemotherapy, aside which the blood thinners, the diuretics, the other ones. So you're talking a cocktail of drugs and dangerous. So man, let's get you right now. This is her 2 weeks later. We're seeing less of a rotation here, and we're seeing now she's more in a central location out of the parasympathetic danger area. Oh, and by the way, they stopped 2 of her medications too because it turns out that she's getting better. And so the doctor that said you have 2 weeks to 2 months to live, I want her to go by and give him like a Christmas present. And she might do it, but the present I was thinking, do you remember the slapstick comedy where someone would take a pie and just bam right in the face? Merry Christmas, But I'm a little aggressive, but let's just fix her. Okay, so when we look at this, we're not just talking about blood pressure medications, because what goes along with it? Cholesterol drugs. This is a drug culture. Okay, so, oh wow, wait a second. Cholesterol, they give statins for that, and they're supposed to give you this drug to prevent what? Heart problems, hardening the arteries, stuff like this. Expert in review of clinical pharmacology, statins stimulate hardening of the arteries and heart failure. Cholesterol drugs cause heart failure. So why would a doctor give you this? Is this based in science? Evidently, they're not looking at it. Wait a second, clinical cardiology, decreased heart muscle function. Let's look at atherosclerosis, increased prevalence of coronary plaques. Don't worry, because the plaquing of the artery will raise blood pressure, but we have drugs for that. We just haven't figured out the number yet that we're going for. The right drug at the right time in the right dosage kills 128,000 people a year. And you call this system based in science? The Journal of Law and Medicine Ethics, they say that there's a myth of safe and effective drugs. And just think about this. Go back to common sense. 10 people. You give each one of them a drug. I don't care what it is. Are you going to get the same response in 10 people? No, it's impossible. And they say the pharmaceutical industry has corrupted the practice of medicine over its influence of what drugs are developed, how they're tested, and how medical knowledge is created. You can see because it's not common sense or based in it. What does the New England Journal of Medicine say? They say, for God's sake, don't go for your annual physical. That there's an inverse relationship, like if you spend more money on this medical system, you get sicker. Okay, but results in a battery of unnecessary tests, ineffective in preventing diseases, unnecessary process and exams. Physicals make sense in theory, but hasn't borne in reality. Why? Because your entire matrix, your entire arrogance of saying, I am smarter than your own physiology. I know you're supposed to be self-regulating and self-healing, but I know better. Your cholesterol is wrong. Take this. Isn't that crazy? I mean, 100 years from now, they're going to look at this and go, no way! People bought into that crap and they're dying like flies? Yeah. We got to look at the nervous system. This is it. You look at the physical, chemical, and emotional stressor. Doesn't that make sense? I mean, it just does. Chiropractic adjustments, work on blood pressure. No kidding. We work with the nervous system. This was a cool study. One adjustment, and they checked it 8 weeks later. Okay, I mean, we'll do 8 adjustments in 4 days, or 3 days, just about. I mean, it's crazy because what are they doing? Why would this work? Why would this work? Because you're taking pressure off of that nervous system and the body is self-healing and self-regulating. Wow. And I love this. It's alignment is associated with marked and sustained reductions in blood pressure similar to the use of 2-drug combination therapy. I would put in parentheses, without the death, destruction, and tissue damage. You know, what's the side effect of getting adjusted? You feel good. It's normal. This is the solution. Find the problem. If you have been diagnosed with high blood pressure, find a professional that understands that it is not a disease, it's an adaptive physiologic response. You need a doctor that looks at the physical, chemical, and emotional stress load. If they're not looking at it, you fire them because those bastards work for you. I have so many patients that come in and they say, what do I tell my doctor? I'm no longer taking the drugs. And I said, well, those drugs were killing you. Yeah, they were, but I really like them. Okay, either tell him that you found something better, okay? Or, you know, take him out to lunch or something. But for God's sake, don't utilize this therapy. I mean, this could be deadly. Does that make sense? These guys work for you. If they're giving you something that's not based in science, they're not looking at your real health, you're not supposed to go to them for your annual physical, and any therapy they do isn't really based in science, but it's poisonous, that doesn't make sense. Look for the cause. I mean, if this doesn't make sense to you, please, for God's sake, take the drug and find a good GP, okay? And you'll have a short life, but tell me where you live because rents will be cheaper there, okay? So I mean, I'm tired of dealing with you know, you deal with people that are saying, well, what should it be? It's normal now based on your stress level. It really is. What should it be? It should be exactly what the hell you're reading. Okay, now deep breathe 10 minutes, drink a glass of water and take it again. It should be different. Okay? You know, I mean, really basic stuff. This is why we put the 5 keys to healing. Nervous system, you got to get regular exercise. And you'll see what on the exercise, the solution is on every one. Why? Because movement is the key. Why is breathing on every one? Because breathing is the key. Okay? You know, check out the Extreme Health Academy. There are so many doctors on here and experts. It's outrageous. ExtremeHealthAcademy.com is incredible. Our cruise is coming up in March. I don't know if there's any cabins left available, and we're having a problem because the ship is like one of those boutique cruise ships. I think it's one where we got to row. Yeah, okay, but you know, they can't find a room big enough for our group because we got like 75 people. So, you know, we might be on an island somewhere teaching. And then look at drjohnbergman.com. The researcher that we have, the writers we got for this, the data collection is outrageous. Okay, now, I got time for one question, or actually 2. Yes, ma'am.
At one time I thought you had if the pulse pressure was greater than 40, there was something going on, you need to see a doctor. And then if it was less, then well, it's up to them.
I guarantee you I would never say if your pulse pressure is greater than 40, you got to see a doctor. I can guarantee that. Yeah, yeah.
And if it was,
Okay, was that the same day I told you that flu shot? Okay, yeah. Okay, that was the day you slipped and hit your head on the parking lot bumper. Okay, let me tell you, 40 is about normal. It's not cut in stone. Systolic to diastolic, the difference should be about 40. Don't freak out if it's 41. Don't freak out if it's 50. Okay, remember, we're blessed with 2 ears and 1 mouth, so now's your time to listen. Okay, so around there is okay. If it's 30, is it okay? Yeah, because that's what your body's doing. If it's 50, is it okay? Yeah, because that's how your body's functioning. It changes all the time. It changes all the time, and it's a pain in the butt to check it because you got to sit down with your arm level, deep breathing. Now, if it's less than 40, that means you're under stress. It could be physical, chemical, emotional stress. If it's greater than 40, that means the blood's not efficient at doing its job. So the blood could be toxic, it could be thicker, you could be suffering from juice deficiency syndrome. I don't know, let's make it up. Water deficiency, okay? All of that, because blood that's not efficient at doing its job, you're going to have a greater pulse pressure. I mean, that's it. That's it. What? Okay, we're going to go over that later. Typically, valves do not wear out. When we go over, because right now we're only talking about high blood pressure. We're not talking about mitral valve prolapse or aortic valve dysfunction, all of which are from long-term toxicities. If you look at mitral valve prolapses, which mean the ligaments that attach that valve into the heart wall are loose, scurvy can cause that. Okay, nutrient deficiencies. And nutrient sufficiencies can heal it. Okay, so there's a lot of things that are misdiagnosed that we did not cover. Okay, a lot of things out there. Okay, so when we're talking high blood pressure, just that. We're not looking at heart dysfunction or anything else, okay? Okay, did I explain that clear enough for you? Okay, good. One more question, very short though.
If you're already on blood pressure medication and cholesterol medication, how do you stop? Do you consult your doctor?
Okay, yeah. If you're already on blood pressure medications, how do you stop? If you're going to like Whitaker Wellness Center, if you're going to, God, who's that? Who's the guy up north who's totally into starches? McDougall. Okay, these guys get people off of all their drugs except for insulin first day. Okay, in this country we have laws. Okay, the person that prescribed the drug is supposed to be the one to get you off of it. What we tell patients is the person that prescribed the drug has to be the one to get you off of it. However, that person is working on false data. Okay, for one, they don't know what number it's supposed to be. For another, they didn't realize that you were in a sympathetic dominant state and they probably took the blood pressure incorrectly. So if you're taking multiple blood pressure drugs, what we recommend is separate them. Yeah, don't take them together. Because if you have 3 to 4 blood pressure medications, we got data that shows that the more drugs you take, the sicker and greater risk of stroke you get, okay? So you're still taking the same ones, just separate them. Drink a full glass of water in between, you're gonna lessen the toxicity. And then you find a doctor that understands you're in the sympathetic dominant. And pretty much there's nobody that does out there. So what we do is we show people how to check their own blood pressure. They deep breathe 10 minutes, you write it down, and then you have to call up the doctor and say, hey doc, I've made some lifestyle changes. My blood pressure is now this. Which one can I stop? And they'll want to get you off the diuretics as quick as possible. But if you're on multiple drugs and they stop one and then you call them up again the next week, doc, it's still too low. Why is it too low? Because you're deep breathing 10 minutes and you're checking it correctly. Okay, so you're writing down the number. And they'll say, well, high blood pressure is the silent killer. Yeah. Okay, which one can I cut down? And so if you're taking 3 drugs, first time they're going to tell you to stop one. Typically it's going to be the diuretic because those damage the kidneys. The second week they're going to say cut one in half. Okay, third week they're going to say cut one in half. And by the 4th week, most patients are just pissed off because they're seeing that the blood pressure doesn't go up when you stop the drugs if you're deep breathing and taking it correctly. But the doctor that prescribed the drugs is the one that's supposed to get you off of it. But they are unaware that your body isn't diseased, it's stressed. And if you deal effectively with the physical, chemical, and emotional stress, then the drug that they gave you is not only not effective, but it can do harm. Okay? Does that make sense? Good. Next week, we're going to do more health stuff. Thank you. God bless you.